Greeting dental professionals and welcome to the ZenFlex One clinical application video. In this session, we will present a shaping technique using the CARE ZenFlex One file with reciprocating motion, enabling you to complete the root canal shaping procedure with a minimal number of files. Before we begin, please note that this video is exclusively for educational purposes. It aims to demonstrate procedures and techniques in a simulated environment. Any deviations or inaccuracies depicted in this simulation are for instructional purpose only and should not be considered representative of real-world performance. Please always follow manufacturer guidelines and professional protocol when using medical devices. This technique utilizes fundamental instruments, including the orifice opener, hand files numbered 8, 10, and 15, ZenFlex One file, size small ISO 20, primary ISO 25, medium ISO 35, and large ISO 45 with a 0.6 taper. ZenFlex One includes dedicated gutta-percha cones that are precisely matched to the ZenFlex One file sizes. After instrumentation and irrigation, we recommend drying the canal with ZenFlex One paper points. The technique is simple, and it depends on the size of the root canal. Our recommendation is straightforward. We categorize canals into two groups, small and narrow, or medium to large. For small or narrow canals, begin by gently opening the orifice using a transverse orifice opener. This helps create initial access and improves straight-line entry. Next, use hand files size 8 and size 10, working carefully and passively to the full working length. Once the path is confirmed, proceed with ZenFlex One, size small, using slow gliding movement and allowing the instrument to follow the canal anatomy. After shaping with a small file, complete the procedure with ZenFlex One, size primary, to achieve the final canal shape. When shaping is complete, confirm the preparation by fitting the ZenFlex One gutta-percha cone, size primary, to working length. Now let's take a look at the video to see how a small root canal can be shaped step by step using ZenFlex One. First, set up the motor in full rotation mode, with the torque set to 3.4 Newton centimeters and the speed set to 500 revolutions per minute. Begin by inserting the orifice opener into the canal to approximately 1/3 of the canal length. Afterward, irrigate the canal thoroughly to remove any debris. Next, use hand files size 8 and size 10 to establish a path for the ZenFlex One small file. Once the size 10 hand file reaches the working length easily and moves freely, shaping can begin. Change the setting of the motor to reciprocation mode. Start canal shaping with ZenFlex One, size small. Gently slide the file into the canal. There is no need to reach the working length in a single pass. Remove the file frequently to clean debris from both the file and the canal. Repeat this sequence 2 to 3 times until the file reaches the working length. Then switch to the final shaping file, ZenFlex One primary, and repeat the same shaping protocol used with the previous file. When the file reaches the working length, stop, remove the instrument, irrigate, and then dry the canal using ZenFlex One paper points. Finally, try the ZenFlex One gutta-percha cone, size primary. If the cone fits correctly, the canal preparation is complete and ready for the next step. Next, we will explain how to use ZenFlex One in medium to large canals. In many cases, medium and large canals present with a wide orifice. When this is the case, the use of an orifice opener may be skipped. Instead, the path can be established directly using hand files size 10 and size 15. Once the size 15 hand file has established the working length and can reach the working length without resistance or friction, the operator may begin shaping with ZenFlex One primary. During shaping, evaluate the tip of the primary file. If debris is present at the file tip, the operator may choose to complete shaping at this stage and proceed directly to medication or obturation. If no debris is present at the file tip, it is recommended to continue shaping using ZenFlex One medium or ZenFlex One large, depending on the canal anatomy and clinical judgment. Now, let's take a look at the video to see how a medium root canal can be shaped step by step using ZenFlex One. Start with an orifice opener if needed. If the orifice is already large enough, this step can be skipped. Set the motor to reciprocation mode before starting the procedure. Check the canal size using a size 15 hand file. If the file smoothly reaches the working length without resistance, you can begin shaping with the ZenFlex One primary file. After using the primary file, check the tip for debris. If debris is present, shaping can be completed at this stage. If no debris is seen, continue shaping with the ZenFlex One medium or ZenFlex One large file, depending on the canal shape and anatomy. There is no need to reach the working length in a single pass. Remove the file frequently to clean debris from both the file and the canal. Repeat this sequence 2 to 3 times until the file reaches the working length. Once shaping is complete, irrigate the canal thoroughly and dry it using the ZenFlex One paper point. Finally, proceed with medication or obturation using ZenFlex One Gutta Percha in the same size as the final file. Before we conclude this session, I would like to share a few practical tips for shaping canals using ZenFlex One. Let's get started.
After locating the canal and stabilizing the file, withdraw slightly before shaping. Use gentle push-pull strokes for precise, controlled preparation. Slow motion shows efficient cutting and coronal debris removal. Clean file and irrigate canal after a few strokes. Continue to full working length.
That is a wrap-up on how to use ZenFlex One. For more information on Traverse, ZenFlex One system, Elements Connect Motor, and Apex Connect, please contact our local representative. We appreciate your attention. For more information about Care products, please visit our website at kerdental.com.